Bermuda has explored two routes with respect to the acquisition of the vaccine. One is through Government House and through the Foreign and Commonwealth Office in the UK, who are providing a proportionate supply of vaccines to which they acquire to all of the OTCs, the ones that have the proper refrigeration and so forth, and Bermuda being one of those countries. And then likewise, through the COVAX facility, we have paid the requisite fees so that when that those vaccines are made available. I actually have some good news. I was on a conference call today, and it seems that we will likely be receiving the Pfizer vaccines by the end of the first week of January.
Thank you, ma'am. Second one is in terms of track and trace resources. We've had a lot of these active cases that are under investigation. I wanted to know, just have we added more people to that team, and to what number of people? What's the size of the team, and have they been able to get more folks to assist with, what was it, like 80?
I don't have the exact number, Jonathan, but I've met quite a number of people in recent days, actually, that have just come on board that are contact tracing. In fact, one young, bright woman I met yesterday evening is actually finishing her master's degree in psychology, so she has the requisite counseling skills that will assist her, because there is a degree of counseling when you're speaking to persons concerning this particular issue. But we have upped our ante, so to speak, and there have been a number of persons that have been recently retained to provide that added support for the contact tracing team.
Oh. Maybe reporters can help out.
I can hardly hear you, Jonathan. I'm sorry. What did he say?
Okay. The third one, this is going back to where we had homeless people being sheltered at Cedar Bridge. That was a different time, obviously, but we wanted to know just what was happening. Yeah, we have a curfew, and it's extended with the unsheltered population.
I'm happy to answer that. Happy to answer that question. This is certainly an issue that has come up, that has been discussed. At the current place where we are right now, we're working with the existing helping agencies who provide services for the homeless to make sure that situations are safe there and effective. At this time, there has not been a conversation discussion to reopen the shelter. However, all possibilities are being explored.
Thank you, sir. Number 4, this is to do with, we've heard is that a staff member at the hospital, the food service, tested positive this week. I guess, can we confirm it and see just how we managed to deal with that? Obviously, there have been a few cases from the hospital. This is within the food department. I guess that's to yourself, Minister of Health.
Actually, it would be more appropriately addressed to BHB, and I'm not in a position to confirm or deny what position there are with respect to cases. I think you should address that directly with BHB.
Righto. Number 5, we've been hearing a lot about young people. I put this question in a couple of days ago, so I wouldn't spring it on you, but we were hoping to hear if there's out of the recent time, a set of days that you could tell us about the number of those proportions of people who've tested positive for age 18 and younger. Hopefully not something that intrudes on privacy, but gives an indication of just how many there are.
Right, and again, I respect that you respect the importance of privacy for individuals, but I can say that of the recent cases and spikes that we've been speaking about in recent weeks, that there are, of those persons age 18 and under, there are 25.
Righto, thank you. I guess last one, in terms of clusters, how many are there? And at the moment, 7 was the last we heard, and perhaps maybe, I know it's gatherings, but gatherings versus workplace, you might be able to fill us in on?
As you rightly said, there are approximately 7 clusters. However, we're now trying to steer away from utilizing that word because we're seeing a number of subclusters that are developing, some within workplaces and some in other social settings, but they all roads lead, so to speak, to 2 principal clusters. One that you've heard me speak about quite a lot recent days, and then a second one that's happened actually that same weekend. So the commonality is that when some of the cases that we're picking up today and yesterday and in recent days, when we start the contact tracing, we're able to direct them right back to those events that took place at the last weekend of November.
Oh, I see. Thank you, kindly.
Thank you.
Good evening, Tom Burgess, Bermuda Broadcasting. We are witnessing vaccines being given to citizens in multiple countries such as the UK, USA, Canada, China, Russia, UAE, etc. Bermuda is going to be a month behind those other first world and even developing countries in getting the vaccine. Bermuda is an overseas territory and a first world country. Why didn't Bermuda get the vaccine at the same time as the rest of the UK?
I think that's a question that you would rightly have to ask the UK. They did indicate that they would, and I'm not trying to be flippant, but they did indicate that they would provide the same proportion of vaccines that they acquire to the OTCs. So we have relied on that. But in the interim, notwithstanding that discussion was taking place, we also secured through the COVAX facility the ability to purchase vaccines when they become available. I think that we would like to have received the vaccines 2 weeks ago when the United Kingdom did. I think it still is a mammoth feat that we'll be able to have by the first week of January vaccines here in Bermuda and start the distribution of our vaccine rollout plan.
Bermuda will have vaccines before most countries in the world, Dawn, and I think your question's a little bit unfair.
I'm sorry, I missed the last part.
Bermuda will have vaccines before most countries in the world, a significant majority of the countries. And I think that your question is unfair.
Okay. 2, Health Minister, on Monday night, you said the International Air Transport Association would be requiring travelers to have a vaccine in order to travel, but on the IATA website, it states that it'd be up to the individual countries. How do you reconcile that with what you said?
I'm just going to go to what I said, which was, thank you, Don, that, and I must repeat this because this is so important because people have been asking this question. This was in my ministerial statement that I gave to the House, which would be in the public domain on Friday, the 13th of December. And I'm quoting, if you don't mind, Mr. Speaker, COVID-19 vaccination will be voluntary, but it is already clear that the travel industry is likely to make evidence of immunity by vaccination as a requirement for crossing international borders. And then I proceed, indeed, IATA, or the International Air Transport Association, has already started to create a vaccine passport for pilots and crew of airlines and as part of their future plans. We can't speak for IATA, and if we already have known from public sources that there's one particular well-known airline that has already indicated that they will not allow persons to board in the absence of having a COVID vaccination. Maybe other airlines will follow. I can't speak to that, but what I can speak to, and I think it's incredibly important for members of the press and particularly members of this community to appreciate, we do not intend as the government to make COVID-19 vaccinations mandatory. Measles vaccinations are not mandatory. So we're certainly not making COVID-19 vaccinations mandatory. But what other airlines do, if other airlines choose to follow the example of Qantas, I'm not sure, perhaps the Minister of Tourism who sits to my left could perhaps elaborate on that more. I can't comment on that, but what I can comment is that we will not make COVID-19 vaccinations mandatory. But what we will do is have sufficient supply for everybody that wants it to have it.